Hidden in plain sight, the thyroid is a small butterfly-shaped gland in the neck that quietly controls metabolism, heart rate, energy levels, and brain function. Despite its powerful role, thyroid disorders often go unnoticed because symptoms develop slowly and mimic stress, aging, or lifestyle issues. Recognizing the warning signs early can make the difference between timely treatment and years of unnecessary health problems. Number 10. Unexplained fatigue that doesn't improve with rest. Persistent fatigue is often the earliest and most overlooked sign of thyroid dysfunction. This is not the kind of tiredness that disappears after a good night's sleep or a quiet weekend. Instead, it feels like a deep cellular exhaustion that makes even simple tasks feel overwhelming. In hypothyroidism, insufficient thyroid hormones slow the body's ability to produce energy at the cellular level, leaving muscles and organs underpowered throughout the day. In hyperthyroidism, the opposite problem occurs. The body is pushed into a constant state of metabolic overdrive, rapidly burning energy and exhausting itself from the inside out. Over time, this relentless strain leads to burnout-like fatigue that no amount of rest or caffeine can fix. When exhaustion becomes your baseline rather than an exception, your thyroid may be signaling that something is wrong. Number 9. Sudden or unexplained weight changes. Unexpected changes in body weight are one of the most recognizable red flags of thyroid imbalance. When the thyroid is underactive, metabolism slows, meaning calories are burned less efficiently. This often leads to gradual weight gain that feels stubborn and resistant to diet or exercise, frustrating people who are doing everything right. In contrast, an overactive thyroid accelerates metabolism, causing the body to burn calories too quickly. This can result in unexplained weight loss, sometimes even when appetite increases. What makes these changes particularly concerning is that they often happen without any conscious lifestyle changes. Over time, untreated thyroid-related weight shifts can affect cardiovascular health, blood sugar balance, and overall metabolic stability. Number 8. Sensitivity to cold or heat. Thyroid hormones play a central role in regulating internal body temperature. When hormone levels are too low, the body struggles to generate adequate heat, leaving people feeling unusually cold, even in mild or warm environments. Cold hands and feet, excessive layering of clothes, and intolerance to air-conditioned spaces are common complaints. On the other hand, excess thyroid hormones increase heat production, making individuals feel persistently warm, sweaty, or uncomfortable in normal temperatures. This heat intolerance is often accompanied by flushing and excessive perspiration. When your temperature comfort consistently feels out of sync with everyone else around you, the issue may lie deeper than personal preference. It may be hormonal. Number 7. Changes in heart rate or palpitations. The heart is one of the organs most sensitive to thyroid hormone fluctuations. In hyperthyroidism, elevated hormone levels stimulate the heart, leading to rapid heart rate, pounding palpitations, or irregular rhythms that may feel like fluttering or skipped beats. These symptoms can appear even at rest and often worsen with stress or exertion. In hypothyroidism, reduced hormone levels slow heart function, sometimes causing fatigue during physical activity, lightheadedness, or reduced endurance. Because heart-related symptoms can be alarming, people often seek medical care, yet the underlying thyroid cause may be missed unless hormone levels are specifically tested. Number 6. Brain fog, anxiety, or depression. Thyroid dysfunction significantly affects mental and emotional health. Low thyroid hormone levels can slow cognitive processing, leading to brain fog, poor concentration, forgetfulness, and depressive symptoms. Many people describe feeling mentally dulled or disconnected. In contrast, excessive thyroid hormones can overstimulate the nervous system, triggering anxiety, irritability, restlessness, and racing thoughts. Sleep disturbances often worsen these mental symptoms. Because mood and cognitive changes are commonly attributed to stress or psychological conditions, Thyroid-related causes may go unrecognized for years, delaying effective treatment. Number 5. Hair thinning and skin changes. Hair and skin cells rely heavily on thyroid hormones for normal growth and regeneration. In hypothyroidism, reduced hormone levels slow cell turnover, leading to dry, coarse, and pale skin, along with thinning hair that may fall out more easily than usual. A distinctive sign can be loss of hair along the outer edges of the eyebrows. In hyperthyroidism, hair may become fine, brittle, and prone to breakage, while the skin may appear warm, moist, and overly sensitive. Because these changes develop gradually, they are often blamed on aging, stress, or environmental factors rather than hormonal imbalance. Number 4. Digestive disruptions. The digestive system is one of the most direct mirrors of thyroid health because it depends heavily on metabolic speed. Thyroid hormones regulate how quickly food moves through the gastrointestinal tract and how efficiently nutrients are absorbed. When thyroid hormone levels are low, digestion slows down significantly. This can lead to chronic constipation, persistent bloating, gas, and a constant feeling of fullness or abdominal discomfort that doesn't respond to typical remedies like fiber supplements or dietary changes. Over time, slow digestion can also alter gut bacteria balance, worsening inflammation and discomfort. When thyroid hormone levels are too high, the opposite occurs. The digestive system becomes overstimulated, pushing food through too quickly. This often results in frequent bowel movements, loose stools, or diarrhea, sometimes accompanied by abdominal cramping. Rapid digestion can prevent proper absorption of essential nutrients, leading to deficiencies that contribute to fatigue, muscle weakness, thinning hair, and weakened immunity. When digestive problems persist without a clear dietary or infectious cause, the thyroid is often an overlooked but critical factor. Number 3. Menstrual and fertility irregularities. Thyroid hormones are deeply intertwined with the reproductive system, making thyroid balance essential for normal menstrual cycles and fertility. In hypothyroidism, hormonal signaling slows down, often causing heavy, prolonged, or irregular periods. Some women experience cycles that become increasingly unpredictable or excessively painful over time. In hyperthyroidism, menstrual cycles may become unusually light, infrequent, or disappear altogether. Both forms of thyroid dysfunction can interfere with ovulation, making it harder to conceive even when other fertility markers appear normal. Untreated thyroid disease has also been linked to higher risks of miscarriage, pregnancy complications, and developmental issues during pregnancy. Because menstrual changes are commonly blamed on stress, aging, or lifestyle factors, thyroid-related causes are frequently missed. Without targeted testing, many women struggle with symptoms for years before discovering the underlying hormonal imbalance. Number 2. Neck discomfort or visible swelling. Unlike many hormonal disorders, thyroid disease can sometimes reveal itself physically. The thyroid gland sits at the base of the neck, and when it becomes enlarged, a condition known as a goiter, it may create visible swelling or a noticeable change in neck shape. Some people experience a sensation of pressure, tightness, or fullness in the throat, while others may have difficulty swallowing, breathing, or speaking clearly. Voice changes, such as hoarseness, can also occur when the gland presses against nearby structures. It's important to note that not all thyroid disorders cause visible swelling, and a normal-looking neck does not rule out dysfunction. However, any persistent neck discomfort, asymmetry, or unexplained swelling should never be ignored. A physical examination, combined with blood tests and imaging when necessary, can detect thyroid abnormalities early, often before more serious complications develop. Number 1. Family history and autoimmune risk. Family history is one of the strongest risk factors for thyroid disease. particularly autoimmune-related conditions. Disorders such as Hashimoto's thyroiditis and Graves' disease occur when the immune system mistakenly attacks the thyroid gland, gradually damaging its ability to regulate hormone production. If close relatives have thyroid disease or other autoimmune conditions, your likelihood of developing a thyroid disorder increases significantly. Autoimmune thyroid disease often develops slowly, sometimes over many years, before symptoms become obvious. During this time, hormone levels may fluctuate, causing vague or intermittent symptoms that are easy to dismiss. While genetic risk does not guarantee disease, it makes early awareness and proactive screening especially important. Routine monitoring can identify thyroid dysfunction at an early stage, allowing treatment to begin before long-term damage, metabolic disruption, or cardiovascular complications occur. If this video helped you understand your body better, like and subscribe for more science-backed health insights that help you take control of your health before problems take control of you.